We decided to research Myasthenia gravis for our project. My name is Crevier.
My name is Kallie Johnson.
I'm Lauren Foresterer.
And my name is Marissa Peters.
And this is our project on Myasthenia gravis. So the words Myasthenia gravis actually have a Latin and Greek origin, meaning grave or serious muscle weakness. Myasthenia gravis is a neuromuscular disorder that causes rapid fatigue and weakness of the skeletal muscles. It worsens after periods of activity and improves after rest. So the more you move when you have this disorder, the worse it's going to get. It's caused by a breakdown in the communication between nerves and muscles. Myasthenia gravis is actually an autoimmune disorder. What happens is the antibodies destroy the nicotinic and acetylcholine receptors. In most cases, it's a result of immunoglobulin. The breakdown occurs at the postsynaptic membrane, and it does not typically affect a person's life expectancy, although if this disorder goes untreated, it can severely affect a person's quality of life. There are available treatments that both control symptoms and allow patients to live a quality life. In the next slide is going to be a video that kind of gives a brief summary of what the disorder is and one of the treatment options that they have discovered in treating this disorder.
Myasthenia gravis is a neurologic condition that patients fail to transmit their nerve impulses in their muscles so that they get weak with repeated motion or repeated activities. And that is thought to arise from antibodies that are produced by the thymus gland, which interfere with or block transmission of those nerve impulses, leading to the symptoms of myasthenia gravis. One of the treatments that has been there is surgical removal of the thymus gland, and that's been around for 40 or 50 years. And it was first noted by surgeons a long time ago that if you took the thymus gland out, in lots of patients, the myasthenia gravis will completely resolve and get better. Not in everybody, but that's sort of what happens. So in patients with myasthenia gravis who have their thymus removed, I generally tell patients that about a third of people who have their thymus gland removed will be medication-free, and their myasthenia gravis will be well controlled. About a third of people will be on dramatically less medication, but still need some maintenance medication for their myasthenia gravis. About a third of people will see no benefit. Our thoracic group believes that the more thymus gland you take out, the better the potential chance for remission. So when we thought about all these issues and having done all these different procedures, we felt the robotic procedure still offered us the best option and the best potential outcome for patients to remove as much thymus as possible. And so that's why we sort of have settled on robotic resection as our treatment of choice for myasthenia gravis in patients who need their thymus gland removed.
Okay, so what are the symptoms of myasthenia gravis? So they can be broken up in a few different categories. The first one being the muscular region, which includes weakness in the limbs, especially in the arms or legs. Also, patients usually have difficulty swallowing. Also for facial, there is a drooping of the upper eyelids and difficulty speaking / pronouncing words. And then most patients also experience double vision as well as fatigue. And you can see in the picture below how these are portrayed. And then flares and remission usually occur throughout the disease since it is usually a disease that lasts for the lifetime. And in the next slide, there's going to be a video of a patient who has extreme drooping of upper eyelids, and they inject a chemical compound in him as a potential treatment option.
This patient has myasthenia gravis. His left upper lid is droopy. When he looks to the right, his right eye does not abduct fully. When he looks up, his left eye does not supraduct fully. When he looks down, his right eye does not infraduct fully. We are now injecting edrophonium chloride intravenously. 1 minute later, the ptosis is gone and his eye movements are nearly normal.
Myasthenia gravis is not considered a genetic disorder. Many individuals who have myasthenia gravis have no prior family history of the disorder. Approximately 5% of diagnosed patients do have family members that have other autoimmune disorders, but they have not found a specific gene for myasthenia gravis. It is found that if you have a very close relative who has MG, the more likely you or other relatives are to get it over the period of time. No research has proven the disorder to be genetically passed, and the disorder is linked to an increased frequency of certain types of human lysokine antigens such as HLA-B8 and DRW3. The image to the right on the top shows how myasthenia gravis affects a normal neuromuscular junction, and then the one affected by myasthenia gravis. And the one below shows where the thymus is located in between the lungs and below the thyroid. Myasthenia gravis is considered to be a neural disorder, in particular a neuromuscular disorder. Many people who are diagnosed later in adulthood. People diagnosed with the disorder can happen at any age, but it is more common in women younger than 40 and men older than 60. Evidence has shown that people with MG have had issues with the thymus located below the throat, which is essential to the immune system growth. Some common thymus issues include thymic tumors, also known as thymomas, or thymic hyperplasia, a condition where the thymus does not work properly. The image to the right shows a normal neuromuscular transmitter and one affected by myasthenia gravis. You can see how the AChR is less in the myasthenia gravis neurotransmitter as compared to a normal one. Myasthenia gravis affects the body in 6 different ways. One, it creates an action potential that spreads down the axon, depolarizing the axon terminal. It then opens the calcium channels, creating an influx of calcium in the terminal. The synaptic vesicles fuse to the membrane, then releasing ACH. The ACH molecules bind to AChR on the postsynaptic membrane, causing the receptors to undergo a change, which opens the ion channels. Once the ion channels are open, sodium rushes in and potassium comes out, causing it to be depolarized on the end plate, which is also known as end plate potential, or EPP. The EPP depolarizes surrounding muscle membranes, causing an action potential in the muscle fiber. Although an action potential is caused, the magnitude will not be enough to cause the muscle membrane to reach threshold, which causes a failure in generating a muscle action potential. The figure to the right shows how antibodies typically fight unwanted bacteria, but in MG, they attack the muscle themselves.
Like stated earlier, this is not genetic nor contagious, but it does happen later in life. It happens when the communication between the nerve and the muscle is severed at the point where they connect, which is called the neuromuscular junction. Antibodies attack the receptors at this junction, which affect the communication between the two. It can occur among any race, gender, or ethnic group. It is more common for women under the age of 40 and men above the age of 60, but it can happen at any age, seen here in the picture to the right. It can happen in infants who get it from their mother through pregnancy, but usually goes away in the first couple months. This is called neonatal myasthenia. Myasthenia gravis is a lifelong disease, but can be managed if treated correctly. Although there is no cure, treatments can help someone live a lifetime more easily if caught early enough. Although there are medicines and treatments out there that can help someone, you must find the correct one for you. Here are some of the types of treatments that people can use.
Another example of a neuromuscular disorder that we see is myasthenia gravis. In myasthenia gravis, the abnormality is that the immune system in those patients gets overactive and it attacks the junction where the nerve and the muscle communicate together. And it can cause symptoms of weakness and difficulty swallowing, double vision, or droopy eyes. And it even can cause difficulty speaking or shortness of breath. And some patients get sick enough that they have to go in the hospital. Fortunately, though, there is very good treatment available for that. Immune medications and also a medication that affects the neurotransmitter that gets involved in this condition can really help people get a lot better or even symptom-free. And we do have a dedicated clinic for that here in our neuromuscular group, because we see specifically myasthenia gravis patients, and is a comprehensive clinic for that. And that helps patients get hooked in for the best treatment options available, and also hooked in for research studies that are available as well.
Through early diagnosis, you can receive treatments and medicine to help you get better and live a more easy life. The goal of the treatment is to increase muscle function and prevent swallowing and breathing problems. Most people with this condition can improve their muscle strength and lead normal or near normal lives. In this video, we see a woman who has myasthenia gravis, and she shows us how she lives with her condition.
Hi, I'm Heather, and I have myasthenia gravis, also known as MG. That means the more I use any voluntary muscle, including those used to see, swallow, talk, walk, use my arms, even breathe, the weaker they get. I can quickly go from the looking fine like this to this. A neck brace to support myself because I can't hold my head up. An eye mask just to keep my eyes open. Resting my back, my arms, my legs, sometimes a wheelchair. A worst case scenario in the hospital for emergency treatment with possible need of a ventilator. Though it's definitely a burden on myself and others, and it changes how you have to live, it can also be a blessing. It forces you to slow down and value every single thing a whole lot more.
And then here are all the references we used to do all this research. Thank you for watching this video, and I hope you enjoyed it.